Hello, and welcome to the URI Pre-Health Advising Fall 2021 Pre-Health Experience Night video series. Today, this video is going to be focused on research from the perspective of our students and alumni. My name is John Albert, Pre-Health Advisor here at URI, and today I am joined by a URI senior and then recent alumna, both of whom have had research be at the forefront of their experience as they prepare for medical school. First is Jewel Voyer, a URI class of 2022. Jewel is a biological sciences and molecular neuroscience major on a pre-MD PhD track. Among her many goings-on, Jewel has been an undergraduate researcher in, I believe, 2 different labs on campus, is an NIH Mark U-Star trainee, has been a URI 101 mentor for many years, lead chem tutor at the URI Academic Enhancement Center, and also volunteers at URI EMS. So thanks, Jewel, for being with us this morning. Also joining us today is Lila Berle, or Lila Berle, I apologize. Yeah, I graduated from URI this past May with a degree in cell molecular biology with a focus in biochemistry. Currently living and working in Maryland doing research at the NIH on tuberculosis. While at URI, she was heavily involved in research both on and off campus. Also worked as an EMT at URI EMS and as a tutor at the AEC, and currently navigating medical school interviews. So we're excited to have both of you this morning to be chatting a little bit about research. So right off the top, we're going to talk a little bit today about what got you interested in research and what you gained. So first, I'd like to hear about what sparked your interest in doing research and what your approach was in finding research positions on URI's campus when you first stepped on foot. So Jewel, if you want to get us started.
Yeah, my first kind of experience of getting into research was actually in my entomology class that I took here. And we had a little section on infectious diseases from vector-borne diseases. And so I was really interested in the topic, and I actually reached out to my professor, and he connected me with a co-PI in one of his labs. And I was actually able to join and got my first experience. And that was actually working in the field out collecting ticks, which was really interesting.
Nice. Thanks, Jewel. Lila, how about you?
Yeah, so I actually had my first experience before I started college, right after high school, because I thought that I wanted to go into actually the PhD route before I eventually decided the MD route. But so I really, I was 18, but I liked to, AP bio, blah, blah, blah. But I was actually more interested in seeing the technical bit, because I realized that what we were learning was kind of, a vast oversimplification of what actually went on in a lab. So I think it was more curiosity in that sense that for me to send a bunch of emails to people and see who would take an 18-year-old.
Yeah. So it sounds like for both of you, it was not quite cold calling, but kind of reaching out to folks that you knew were doing research and getting connected that way. How was that experience? Was that stressful to be reaching out kind of without any sort of, maybe connection to the different folks you're working under? Lila, I wonder if that was the experience for you.
I think that it's kind of natural to feel nervous, or especially when you get a rejection. I remember, a lot of PIs are incredibly busy, so they might just send one line of, no, I'm not taking anyone, or, oh no, I'm not interested in a student with your background. But I think it's like, you really need to realize it's not personal. Once you remove yourself from this, personal aspect of, oh, they're, judging me or something, it's actually, in my opinion, if you think of it as a game, it's kind of amusing, actually, just to see like how many emails you can send, and then how many people, might get back to you, whether it's a positive or negative response. I think that once you surmount that, kind of negative feeling about reaching out, it gets easier over time.
Yeah. Jewel, how about you?
Yeah, my first experience was like really reaching out on like cold emailing professors, was trying to find like a home placement here. And I was working with like my Mark U-Star advisor, one of the programs I'm in, to go through like how I would section my emails. And I found that there's like a lot of resources online that helps like students like format their emails to reach out to professors that have research labs.
Nice, great. So you both have been, like I mentioned in my intro, involved heavily in research, both on and off campus. I'm wondering if you talk a little bit about some of the different projects that you've done. Jewel, if you want to get us started, just talking about some of the different things you've done involving research.
Yeah, so like I said, my first experience was in collection of ticks. And so that was actually cut because of COVID, but the idea was that we wanted to see if their questing patterns would be affected by presence of Lyme disease. And so we didn't get to fully finish that. But I took kind of like my interest in ticks, and I joined a computational lab during COVID, where I learned how to develop phylogenies, and I looked at the different morphological characteristics of those ticks and their geological locations to kind of like see if I could find any like evolutionary patterns. So that was one of my experiences as well. And then I currently am also in a lab developing a COVID-19 vaccine.
Nice. Awesome. Certainly relevant to what's going on, in our day to day for sure. Lila, how about you?
Okay, Jewel, sorry, I didn't know about your tick research. That's really cool. I just want to say that. Yeah, so my first experience was actually in an immunology lab working with whole blood and plasma samples of HIV patients who had been on highly effective therapies. So I did a lot of like cell quantification, FACS, FlowJo, and I think that was kind of just, learning the basics of handling, like a human cell culture and things like this. And I then worked in bacterial byproduct signaling for a year, which was really interesting because I was working with anaerobic bacteria. And that was something that is a new experience. Everything is like under the hood with big gloves and yeah. And I enjoyed that a lot. That was more of the kind of what got me into biochemistry. I also did do a public health project working on patients who had been admitted to McLean Hospital for various eating disorders, and then kind of trying to correlate treatment outcomes with kind of various conditions or like comorbidities that they presented with at the time of admission. And then I worked in Dr. Jamie Ross's lab in undergrad. That was kind of different because of COVID-19, but it was really great because we got to share a lot of methods paper and kind of talk more about the, not really like intellectual, but the procedural aspect and kind of ingredients in a lot of the assays that we usually run and kind of take for granted. So that was cool. And then right now I'm working on multi-drug resistant mycobacterium tuberculosis at the NIH, more of on the microbiome side. So yeah, I mean, I feel really lucky to have gotten such a kind of a variety of exposures as far as research is concerned.
Yeah, thanks both for talking about some of the different experiences that you've done. For both of you, I'm wondering if you could talk a little too about some of the like technical skills that you've picked up, working in these labs or working in the field, and then also some of the soft skills, whether that be the type of thing that is not necessarily directly applicable from like a lab to maybe medical school, but some of the skills you learn in terms of like leadership and communication. Lila, if you want to get us started.
Yeah, so I mean, of course, as you're, being immersed in different lab environments, you are learning, how to use different software and things like that. And you're also learning how to do, run certain like biochemical assays and like, maybe, grow up bacteria and kind of figure out appropriate endpoints for, certain assays and then certain studies. So that's more of the technical. I don't want to like name things because that might just get a little mundane for people who are listening. But I think soft skill wise, this is something that it took me a little bit because I'm, not generally a very kind of, aggressive person, but I really tried to learn how to like advocate for myself. Like, I have had experiences before where the postdoc is incredibly busy and they're just like, oh, can you just, run this ELISA or whatever? And I'm like, okay, sure. And then I come back later and say, oh, can you actually tell me, what we were doing and what, scientifically and molecularly the point of that was. And then usually people are receptive and they will kind of like go through the pathway that they were, interested in. And that's really nice. But I think that's my main thing. And I've been really, really fortunate to be working in a lab right now. The PI is very open to, when I walk into his office and I ask questions, he'll actually answer them. So yeah, I think kind of putting yourself out there at first is intimidating, but you really do need to like advocate for yourself and show that you're interested in the scientific portion of it, because the technical stuff is super cool too. But in my opinion, it's really, really important to have both as you're having experiences.
Great, Lila, thanks. Jewel, how about you?
Yeah, so like I've also learned a lot of different like, hard technical skills in the different labs that I've been in, whether it's like out in the field collecting ticks and knowing proper like PPE with that, or if it's like under the hood, where I did a lot of cell culture work this past summer. But I think one of the soft skills that I have learned a lot is science communication. And like through my different labs that I've been a part of, I've had a lot of opportunities to present posters, do oral presentations, or like assist with like manuscript writing. And I think that's also really important to really understand what you're doing and being able to communicate it to a majority of people, whether it's, you know, professors who know exactly kind of what you're working on, or if it's your parents or that you're just talking to, trying to explain like what you've been doing in lab all year.
Yeah, great. You know, Lila, you touched on this a little bit as well. What was it like for both of you to do this research under the direction of like a faculty member, under a PI, like an adult? You know, sometimes I think in a lot of ways it's intimidating to be kind of reporting under a scientist, you know, for our students that might be feeling anxious about that. What was that experience like? Jewel, maybe you can go first.
Yeah. So when I started in research, I wasn't sure how to kind of approach a PI, in a sense that I felt like I might not know enough, or they might think that like I wasn't as smart as maybe I seemed when I emailed out or first talked to them. But I think from my experiences that they're really open, and they should be, in teaching you. So it's just really like putting like your foot forward to reading publications and coming to them with questions. And they also teach courses most of the time too. So they like know that there's students who will have questions, and they should know how to kind of like approach that with you.
Yeah, Lila.
Yeah, so I just want to echo what Jill said. That, yeah, fantastic. I agree. And I also think too that it's really important when you're thinking about approaching, you know, PIs or postdocs or PhD students, whoever you're working under, you to have a very honest assessment of your own knowledge first. So like if you seriously know nothing about a certain assay, it's probably not appropriate to walk up to them and say, oh, like, tell me everything about this, right? Like, it's in my opinion and experience, it's a little bit more helpful to kind of maybe, you know, find like a Thermo Fisher like scientific tutorial and watch that, or even something on YouTube, or just read the protocol so that you have like a little bit of understanding of what you're asking, so that they can actually address something specific. I think that that's really important, and that also that usually the individuals that you're working under enjoy doing that kind of thing. But the flip side of that is, and I didn't do this enough, I'm trying to work on this. When there's something that you're, you know, pretty confident about and something just doesn't make sense, it's really important to speak up. The number of times when I've been like, oh, I don't understand that, I must have missed it. And then another lab member asked the question who's like a postdoc or something. And I was like, oh, like, you know, I could have asked that. That maybe wouldn't have been a dumb question, right? So I think that kind of assessing your own level of understanding before you speak up both ways is really important.
Awesome. Thanks, folks. One last question. Both of you are well on your way, you know, to medical school, and I'm wondering what it has been about being engaged in so much research that has kind of confirmed that you know, this path to medical school and to becoming a physician or a physician researcher, you know, is the right path for you. You know, why are you interested in medicine, you know, as opposed to you know, only focusing on research? I'd love to hear that, you know, for our students. Lila, if you want to go first.
Yeah, so that's a great question. I think for me, I love the idea that everything in research, if you're doing human cell line or, you know, immunology, I mean, even vector-borne, because obviously it infects humans, but everything in research ultimately comes back to biochemical mechanisms of human disease state. And I think that when you're actually able to see those processes under, you know, whether it be you're looking under a microscope or you're doing like a set of assays to determine like a certain like protein signaling pathway, I think that that's like something that's really unparalleled, because you don't just get the clinical presentation of, you know, XYZ disease state, but you can see how it likely manifested. And to me, that's been, I think, the most interesting, because I don't want to just be viewing things from a one-dimensional perspective of what we can see and what patients tell us. I really do want to look at it from more of the back end, if you will, if that makes any sense.
Yeah, absolutely. Thanks. Jewel, how about you?
Yeah, I totally agree with what Lila's saying. Like the reason why I want to go into MD PhD is basically that like as a previous patient myself, like I've seen the struggles of kind of doctors doing only so much that they can with the current like therapies and current knowledge that there is. And I can definitely tell that there's always, more work to go into to solving whether it's infectious disease, autoimmune cancers. And so I really find like that it's important that that there are physician scientists so that they can go into the research about, what the mechanisms of like that are affecting their patient, but also being able to treat them as well with the like not prior knowledge that they get from research.
Awesome. Well, Jewel and Lila, thanks so much for taking the time this morning to chat about your research and your path. That'll wrap things up for us today. If folks have questions that they'd like to direct directly towards Jewel or Lila, feel free to reach out to us at Pre-Health Advising and we can provide their contact information. I'm sure they'd be happy to chat further about the things they've been doing on or off campus. But this will conclude the video for today. Keep an eye out for other videos that we'll be posting throughout this semester and next. And yet again, thanks Jewel and Lila for taking the time today to be chatting about research.
Thank you.
Thanks.